My name is Mike Tyler, and I've been asked by the BAAPS Council to say a few words about GDPR. Now, GDPR stands for General Data Protection Regulations, and there is a new set of regulations which are coming into force on the 25th of May. The reason for this new set of regulations being required is that the last set of regulations were conceived in 1998, when an awful lot of what we use in our everyday lives, especially smartphones, electronic notes, and all the other electronic forms of information, were just not really in everyday use in most people's lives. Because they are now in everyday use and in most people's lives, this new set of regulations have come into force. I'm not a lawyer. This is not official advice, but it is designed to be helpful, and really what I'm going to do is to tell you how I, in my relatively small private practice, have approached this, just as hopefully to be something that's useful to you. I think there's three things though that are absolutely true. The first is you cannot ignore this. If you handle data in any way, and everybody will do if you have a private practice, you have to have thought about it. The second thing is it's quite easy. You have to go to the website in the Information Commissioner's office. The website's been put together very well, I think, and there's an awful lot of advice, and it's a little bit of time, and it takes a bit of reading, and then a plan needs to be set. So what I'd like to do is to take you through how we approached this forthcoming regulation to ensure that we are compliant. On the website, preparing for GDPR, 12 steps to take now. Step by step, doesn't take you very long to do, and it gives you a whole series of exercises. Obviously, I'm not going to go through all of those for the minute, but I am going to map for you how we have achieved our compliance. Slight correction, it actually does take a bit of time, sorry. So the first thing we did was that we mapped our data. We worked out that we get data from three sources: phone call, letters, and emails. Now, at this point, we are beginning to process data, and all of that data is going to the support staff. Now, we need to advise patients that we are going to process data, and we're going to do that verbally. And the lawful basis on which we are able to process data is contract. They have asked us for a service, and we're going to tell them verbally that we are recording their name, their date of birth, and not only that, we're going to tell them that we are going to share their data with the hospital in whose clinic they're going to be seen. So at this point, we are already sharing data with, and they need to know that. Now, for some of the letters and emails, we are being referred patients, and actually the consent for us receiving the emails and everything comes from the referrer's GDPR. They must have informed the patient that they will share data with another healthcare professional, because at this point we haven't even spoken to the patient, and yet we have their data. The next thing is the support staff will give a clinic appointment. Before they have the clinic appointment, we send them what we term a FIN1 letter. So FIN stands for Private Healthcare Information Network, and it is a letter that we are required to send by law that points them to the information that is publicly available on outcomes and surgery. So you must send this by law. So the other thing we're going to send them at this point is our privacy notice, and our privacy notice tells them how we're going to process the data and the legal basis for that processing. So at this point, at the clinic appointment, there is medical data involved. So we are processing sensitive data. And the legal basis for that processing is we have a legal obligation to keep accurate medical records. So that is the basis for which we're going to do this. And the patient is informed of this in the privacy notice. In addition to our legal obligation, the patient is informed that we may have to process their data as a public task. This, for instance, if we diagnose tuberculosis, we're under duty to inform public health authorities. And there may be a need to process data if it's in their vital interests, should they fall unconscious or should there be some medical emergency. So we have a layered approach to the lawful basis with which we process data. Initially, it's a contract because they have contacted us. When we make up a set of medical notes and give a medical opinion, we are then under a legal obligation to maintain accurate records, and we bear in mind that there are these two other tasks that may come into process. And all of that is in the privacy notice. Clinic appointment, there's really 4 outcomes. So the key thing is that each one of these creates a set of notes, it creates an electronic record, and we then mapped this so that we could work out how we process the data. So now, if the patient arrives and they're just going to have further discussion, a set of notes is made up, there's electronic information and financial data again is collected. The patient may then have further discussion, but they then may move to surgery, okay? And then once again, the paper notes are updated, PPM is updated, more financial data is collected, and at this point, there also photos are generated. Now, the photos will need an additional level of consent. Following surgery, the patient will be discharged, and at that point, we then have, once again, the usual information. The financial data is anonymized, and then a retention policy about what to do with the notes and what to do with the PPM accounts is then created. And obviously that retention policy is in line with standard medical notes, as said earlier, in line with the GMC policy. Yeah. So the other thing we've done is an audit of the companies that in which we share or our data is processed with. It is important that we, or I as a data controller, are satisfied that they understand and are able to deal with the data in compliance with GDPR regulations. We then we looked at the storage of where this information is stored, and we've satisfied ourselves that the security on these is as tough and as secure as can be reasonably expected. So in summary, we have managed our GDPR by 1, we've opened up a file. We have recorded all of the steps that we have made so that we have a record of what we've done. We've done a data mapping audit. Obviously, this is today's date. We did this before then. We've recorded how the information comes in. We've looked at where the information goes. We've looked at the layered legal basis for storing and processing this information. We've worked out our privacy notice and how the patients are going to be advised of the privacy notice. We've looked at the people for whom we share the data. We've then mapped the process of once they come to us, the process and the outcomes of having seen us, the further processing of data, the additional data that may be gained, the additional companies that may be involved at this stage, and then finally the retention and the deletion policy that we're involved. We've checked that all the companies that we're involved with and satisfied ourselves that they will use the information in a GD compliant manner. We've done a risk analysis, a risk gap of where we think our risks are. We have then lastly trained our staff in giving this information, gone through this map with them, and this is a process which needs to be ongoing, and therefore it's something that we need to revisit on a regular basis, and we will do that. My advice is that if you are a data controller, and I am, if you have a private practice, you probably will be the data controller, you must be satisfied that your processes are compliant with GDPR, that you have a legal basis for processing the information, that any support workers that help you with your private practice are aware of this and aware of the regulations and understand that they now have a responsibility. In the old regulations, information was an asset. Information now is a little bit more of a liability. In the old regulation, I was responsible for everything as I was the data controller. Now, the responsibility is passed on also towards data processing, and it is my role to ensure that they are aware of that and that we have mapped the processes and we have ensured that they are compliant and as safe as is reasonably possible. Thank you.